Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now we look at the effect of the myoglobin and carbon monoxide, and this is with respect to the oxygen hemoglobin dissociation curve. So first, going ahead with the myoglobin. So myoglobin is the hemoglobin pigment in the muscle, and here the myoglobin, it binds only 1 mole of oxygen per mole. So it binds 1 mole of oxygen per mole, and it shows the NO more effect. The myoglobin, it shifts the oxygen hemoglobin curve, the oxyhemoglobin curve, and this is shifted to that of the left, and the curve loses its sigmoid shape. So curve loses sigmoid shape. Next is it becomes a rectangular hyperbola. So rectangular hyperbola is formed. So here the P50 of the myoglobin is only 5 mm Hg compared to that of the P50 of hemoglobin, which is about 26 mm Hg. Next, moving on to the carbon monoxide, which is also known as CO. So this binds to the hemoglobin to form the carboxy hemoglobin. So the affinity of the hemoglobin to that of the carbon monoxide is about 210 times greater than its oxygen, So even minor amounts of CO greatly reduces the capacity of hemoglobin to the binding of the oxygen. So even minor amount plays an impact, minor amounts of CO. So it reduces the capacity of hemoglobin to bind the oxygen. Next, moving on to the effects of the CO, they are decreases. So they decreases the oxygen capacity. So CO, they decrease oxygen capacity of blood, and there is a shifts of shifts the oxyhemoglobin, shifts the oxyhemoglobin curve to the left. Now looking at the CO poisoning, there is it causes anemic hypoxia. So the CO poisoning causes anemic hypoxia since almost all the hemoglobin, it binds to the CO, and the hemoglobin is practically unavailable for the transport.